Hello and welcome to Digital Québec, Quebec City's digital magazine. I'm Sandra-Jessica Couturier and today we will be talking about health and digital. Today we talk about a subject that affects everybody, health. It's becoming harder and harder to get a family doctor these days, and also we have to wait for hours and hours at the emergency room, and also for operations that are not urgent. Why is that? That's the question we'll ask our guests today. Throughout the world, digital technology has given rise to help people's lives. Today I have Alejandro Gaviria, founder of Hacking Health Quebec
Chapter.
Yes. What is Hacking Health?
Hacking Health is a global movement of people, innovators, people who want to tackle problems in healthcare. So we are designers, clinicians, patients, citizens, developers, programmers. So we work together in order to find solutions to those problems in healthcare systems.
And where do these events take place?
We have different cafes in order to co-create solutions about those problems. But at the beginning, what we do is identify challenges. So we ask for clinicians in order to give us their challenges in healthcare systems and face to patients and citizens. So at the beginning, challenges, then co-creation processes. We have several places in the ecosystems that we work together. So at fall, we work together in a marathon in order to prototype those solutions. So that's the mainly problem.
And tell us why you got involved with Hacking Health.
Why? Because the Economic Development Agency in Quebec City has bring us this opportunity in order to evaluate or explore how can we meet or bring people together in order to do it, because it's very difficult. Every community speaks different languages, so every community has different interests and goals. Mm-hmm. So my main interest, professional and personal, is innovation management for social impact. So that's why I get in my implication.
Okay, and who participates in those kind of marathons?
Yes, as I said before, patients, citizens, developers, designers, entrepreneurs, decision makers also. That's very important for us also because.
And what kind of? Can you give us an example?
An example of our project.
Yeah.
Yes, we have projects for children, for example, children with some diseases that they want to. For example, understand their illnesses. So in that way, we developed some video games in order to show them how to manage their own. So this their language. So we do that kind of stuff.
That's very interesting.
That's very centered in the passion. But other kind of projects are related to knowledge management for practitioners. We have some different kind of projects actually in the healthcare system. Those are the most difficult problems because it depends of decision makers, but also with people, citizens and practitioners. Yeah.
Perfect. And how does all this idea and all that? How did it all start?
Actually, Hacking Health in 2012 in Montreal, it's born with that objective at the beginning. We wanted just to work together to bring down the barriers of innovation. So the most important thing is that people collaborate together in order to tackle those kind of problems, because innovation is instead very difficult. Mm-hmm. Innovation in healthcare is even harder. Yeah. Harder, exactly. So the most important thing is that people connect together, exchange together in order to understand. At the beginning, it's just understand the problem, the most important problem in the big challenge. Mm-hmm. So then solutions come from digital technology and other kind of stuff. It's not just about digital technology, but also design approaches, different kind of design.
And when do these people meet to discuss all that?
When at the beginning, we do it in spring. for challenge identification. And then at fall, we start with cafe. So some kind of cafes in order to start the co-creation or the ideation process. Then the conception, the prototyping is in the marathon. It's at the beginning of November. So in general, is that the process. Then the most important thing is the follow-up of the projects. We want in Quebec City to bring that support in order to bring those projects to term. Even if the project is not viable at long term, we want to know why. Okay, so those are learning lessons. So that's very important for us.
Why the word hacking?
Hacking, yes, this is a very negative connotation for most of people, but hacking is a way of thinking, okay, thinking differently, breaking down problems, we use digital technology in order to understand, to breaking down those problems, and then finding the best way to solve that problem. It's not just technology. As I said before, it's about understand the problem, using technology to understand the problem.
Yeah, exactly.
So that's why we use hacking, exactly.
Oh, perfect. And is it only in Quebec or is it worldwide? How does it work?
Yes, the movement is a global movement. We are about 47 chapters in the 5 continents. So we exchange together also leaders in every chapter. We exchange together every month in order to understand the good lessons, the learned lessons also.
Learn from others,
and we exchange knowledge in order to. That's a very good initiative. Now we have a community of practice initiative in order to understand how to help healthcare institutions, in order to integrate those solutions. That's the most important thing to do right now. So we are doing that together.
Thank you very much for your time, Alejandro. It was very interesting.
Thank you.
Next, we will see another innovation, Moveck.
Moveck is a Quebec City-based company that offers technological and digital solutions to help with a 3D analysis of human movement. In fact, the company specializes in the development of software and solutions that enable the display, processing, and analysis of movements, all based on acquired data, mathematical models of the body, and motion capture. Why? To help clinicians, biomechanics, trainers, coaches, and other professionals break down physical movement in order to help their patients or to help their athletes. So, Moveck helps healthcare professionals as well as specialists in sports, science, and engineering. Concretely, better analysis helps us with physical rehabilitation, improving certain ailments, improving performance, creating prostheses close to human movement, and so forth. This can help many people. What can Moveck do for these professionals who work in the field of movement? No longer having to extract, compile, and compare the data they gather. Moveck solutions take care of all of that, and more. They can therefore better analyze the data and find the treatments, exercises, and training adapted for each individual, which allows them to devote themselves to the well-being of their patients. Want to know more? Go to Moveck.com.
The healthcare in Quebec, as we know, is facing many challenges. Today I have Marie-Claude Mirand, Operation Manager, and Jean-Pierre Després from
Alliance Santé Québec.
Can you explain all these issues that we're facing with the health services right now?
Well, if you're looking globally at health in Quebec, in Canada, North America, actually all over the world, we're dealing with an epidemic of what we call chronic societal disease. Unfortunately, the healthcare system is really geared toward disease management rather than health.
Yeah.
And at Alliance Santé Québec, we have now this collective effort from a multidisciplinary expertise where we take a holistic look at those issues. How can we collectively develop innovative solutions so that we have a better understanding of what are the key issues in terms of health in Quebec? In our case, we're dealing with the Quebec City ecosystem, the large metropolitan area. And how could we fix the gap between what we know, what we do, and fix the gap between clinical practice and the development of population-based solution? And when we put those questions on the table, We have remarkable opportunity for numerical strategies, for information technologies. There are tremendous opportunities out there.
So you do use digital for that?
Absolutely.
And how does it help?
Well, see, for instance, if you go to primary care, you go to see a primary care doctor. Let's use an example. We have 800,000 individuals with type 2 diabetes in the province of Quebec. The physician is going to measure blood pressure, your cholesterol, check on your diabetes, but he or she will have no information about your lifestyle. You know, the way you eat, whether you're physically active, whether you're fit, whether you sleep well. And therefore, if we were able to capture this information with, whichever technology, and provide also feedback regarding healthy or unhealthy behaviors with patients, we could substantially upstream work on factors that leads, to all those diseases filling up our hospitals.
So basically, how would that help the patients?
It would help patients tremendously because, the scenario, if you are among those 800,000 people living with diabetes, we're going to pile up medication, and then you're going to end up with becoming blind or with, kidney failure, heart failure, complications that are very costly and obviously cause prejudice to your quality of life. So if you work upstream, working on solutions to help patients adopt a healthier lifestyle, well, you will tremendously improve the quality of life of the patient and reduce the burden to the healthcare system, which is right now completely saturated.
Have you already tried anything digital, or?
Yes, they are pilot studies that we do that are that have generated very, very promising.
Do you have any examples for us?
Yes, we have, for instance, there was a pilot project that was discussed as a session that we have this morning on the south shore of the St. Lawrence River, an initiative where the patient had access to their medical records, so they could check on their numbers, patient with diabetes over time. We're doing at the Heart and Lung Institute an initiative where we are capturing those lifestyle vital signs, and we have shown and we have published those data actually that we can reduce the complication of diabetes, we can improve the diabetes, and we can also globally improve nutritional quality and the physical activity habits of those individuals that have to deal with risk factors. But right now, it's very important to emphasize that in the primary care system, the system is not equipped actually to introduce those innovations where you could provide additional information to the health professionals and to the patients.
How does it work with primary care right now?
Well, actually what we usually see in day-to-day work is the way that we have sometimes some difficulties sharing the information. Yes, we do have electronic solutions that are implemented in the clinics, but what we need to do is to get the professionals to work with it, get them to work with it, put the information in there, and share the information. And not within only one clinic, but within the population of the medical care.
So everybody's got the same database.
Exactly.
And the same, okay.
The clinics, the laboratories, the pharmacies, the hospitals, the information has to be shared with all the people. What we see too is that with chronic diseases, we now have multiple professionals that work with the patient. We have a doctor, we have nurses, we have professionals, nutritionists, we even have physical educational people that work with them, and they all need to have access to the different information so that they can have the best treatment plan for that patient. And we do have to give this information to the patients too.
Of course, yeah.
The main issue that we have is to get all those people to work together, use those technologies, and have the same platform all over the province too, because we have something in the clinic that sometimes doesn't speak with the system that we do have in hospitals, and now we have to link all of those software together so that all the information has to go around
together in one database.
That's usually what we see.
So basically, any failures or anything that you could work more on, and
well, actually, it's really technical, so that all of those different software or systems do speak together so that we can share the information. And that's usually what we see as the main issue at this point, technically. And then
what can be done to improve that?
I think that usually different companies do make those software. And let's just say that they're competitors in their own fields. So I think that at some point they might have to maybe work more together.
Yeah.
So that the systems can talk to each other.
Yeah, exactly.
And we also have to put on support and training for all of those professionals that will need to use that. We have doctors that have been doing their medicine for 30 years and they're not used to a medical file that is electronic, and they need to be taught how to use that.
And it's going very fast too. Everything changes. Everything
very,
changes throughout the years.
Very,
you know?
very fast.
Yeah.
One day they have a pen and a paper, and the other day they have.
They're on their laptop.
They're on their laptop
Yeah.
and on their smartphone and everything. So,
And it's a paradigm shift. You see, the healthcare system, it was in the past, you know, you're sick, I'm the doctor, I will fix you.
Yeah.
It doesn't work like this.
No, it doesn't
so
work
it's
like that
really
anymore,
a paradigm shift, and I have a great deal of admiration for their project, because it's taking a holistic approach and empowering actually the patient by providing relevant information to the patient. But we need to
And the right information
keep
as well,
in mind
yeah.
that the whole healthcare system right now is not very permissive to such transformative change, because it is a paradigm shift. So what they are doing is really extremely important as a demonstration project to show the added value of doing this.
Yeah, definitely. Anything to add or anything in your information?
at this point, what I could say is always remember that in the middle of all this is the patient himself or herself. So we have to work all in the same direction so that the health and the patient is put in front. So I think that's what we have to keep in mind
That's very
in all of
important.
that.
Yeah.
Absolutely, the citizen, the patient is at the center of this whole initiative. And I would like to add, do we have the choice of not going in that direction? You know, what kind of society do we want to leave to our children and grandchildren? We have no option but trying to do this.
Exactly. Thank you very much for this great discussion. Up next, I will be talking to Patrick Sauvageau from Upfront.
BluPanda is a startup from Quebec City founded by a team of entrepreneurs, scientists, and software engineers, which creates a platform that offers management support to healthcare services. The idea behind the project is to take advantage of the fact that everyone owns a smartphone, which connects them everywhere. And so, by using a smart server, we can automate the management of key healthcare processes. This includes patient admission, treatment and authorization to leave, as well as patient care coordination with his or her family, instructions for discharge, and patient education. It allows doctors and medical personnel to collaborate and include patients and their families in certain processes for better efficiency. As for the smart server, it analyzes in real time what works and what doesn't, and it adjusts the processes accordingly. Therefore, the platform is constantly improving, allowing teams' performances to do the same. In short, with BluPanda, medical teams spend less time managing the essential but non-medical, and instead they can put their energy into the right place, which is to say, healing and ensuring the well-being of their patients. Visit BluPanda.com for more information.
Digital healthcare not only affects our hospitals and public institutions, it also affects private clinics. They also need tools to help manage with their appointments, records, and sales. Today I have with me Patrick Sauvageau, optometrist and founder of Upfront. How does Upfront help with optometrists?
So our goal is really being a facilitator for the eye care industry, helping the clinics take the digital shift.
Okay, why the name Upfront?
The name Upfront is really a combination between optometrist, and being in advance, being at the front of.
What are the tools that you offer on Upfront?
Okay, so we're building basically web stores for independent practitioners, so they can offer their products online, and it's a turnkey solution. So we take care of everything, take care of the pictures, and we logged with their inventory, their physical inventory. So all of what they are offering in the store, it's really a virtual extension of what they're already offering.
Perfect. And is it only in Canada or is it worldwide? Or
right now it's in Canada. The offer is in Canada, but we have projects to go in the US and be international.
Could the same model be used for any other health specific?
Okay, so Upfront really addresses a specific problem related to the eye care industry. There's no currently private clinics that offer web stores to meet the customers' needs. So what we're trying to do here is really help them out, building web stores for them, making a turnkey solution so the consumer can go on their web store and select up to 3 frames and take an appointment to go and try them on for real at a specific moment, a specific time.
Wow.
And so or order the contact lenses legally and with a lot of conviviality.
Okay, so that's what's so specific about Upfront.
Exactly.
You only have one database, and
there's only one database. We connect with their inventory, with the inventory of the clinic, and we connect with the all their patient database.
Okay.
So it's really, like I said, a turnkey solution.
And how do you join?
Go on Upfront.ca, write us, and we'll be there for you.
Perfect. Thank you so much for your time, Patrick.
Thank you.
It's already the end of our show today, and I think we've discovered some great examples on how digital can help our health. On our next episode, we will discover some technologies and applications that can help with sporting events as well as outdoor activities. I'm Sandra-Jessica Couturier. Thank you for watching.